Is it possible for a boy to have 3 lines on his ultrasound and still be male?
Hey there, welcome to our video. Today, we'll be discussing an interesting question. Is it possible for a boy to have 3 lines on his ultrasound and still be male? Ultrasounds are commonly used to determine the sex of a baby during pregnancy, but sometimes the results can be a bit confusing. So, let's dive in and explore this topic further.
Understanding ultrasounds and gender determination.
To understand this question, it's essential to have some background knowledge about ultrasounds and how they are used to determine the gender of a baby. Ultrasound technology uses sound waves to create images of the inside of the body. During pregnancy, ultrasounds can provide valuable information about the health and development of the fetus, as well as reveal the baby's sex. Typically, when determining the sex of a baby using ultrasound, healthcare professionals look for certain anatomical features. In the case of identifying a male fetus, they typically search for the presence of the penis and testicles. However, there are instances where the visual appearance of the genitalia may be less straightforward.
Variations in genital development.
Genital development can vary, and sometimes the appearance of the genitalia on an ultrasound can be ambiguous or not align with the typical male or female characteristics. This can occur due to various factors, such as the position of the baby, the angle of the ultrasound probe, or the gestational age at the time of the ultrasound. In some cases, a male fetus may exhibit what appears to be 3 lines on the ultrasound image. These lines may resemble the appearance of female genitalia, leading to confusion and uncertainty regarding the baby's sex.
The 3 lines phenomenon.
The 3 lines phenomenon seen on an ultrasound image is often associated with the presence of female genitalia. These lines may represent the labia majora and labia minora, which are the external structures of the female reproductive system. However, it's important to note that the presence of 3 lines does not necessarily indicate that the baby is female.
Confirmed male sex despite 3 lines.
While the 3 lines appearance on an ultrasound can be concerning for parents expecting a male baby, it's crucial to understand that ultrasounds are not always 100% accurate in determining fetal sex. In some cases, the visual cues on the ultrasound may not reflect the true genetic sex of the baby. To obtain a more definitive determination of the baby's sex, additional diagnostic tests, such as amniocentesis or genetic testing, may be recommended. These tests can analyze the baby's chromosomes and provide a more accurate assessment of the genetic sex. In certain instances, even with the presence of 3 lines on the ultrasound, the baby's genetic sex may still be confirmed as male through further testing. This means that despite the initial confusion, the baby is indeed male, even if the appearance of the genitalia on the ultrasound suggests otherwise. In conclusion, the presence of 3 lines on an ultrasound image can be misleading when trying to determine the sex of a baby. While it is commonly associated with the appearance of female genitalia, it's crucial to remember that ultrasounds are not infallible and can sometimes produce ambiguous or misleading results. If you find yourself in a situation where the ultrasound indicates 3 lines, but you were expecting a male baby, it is advisable to consult with your healthcare provider. They can guide you through further diagnostic tests, such as genetic testing, to obtain a more accurate understanding of your